Okay, by treating the horse leg, we can still place the return electrode on the back, because it's very easy to put it there and it's out of the way when you sit working and you're not in the way with the legs on the horse. But first, before we place it there, we have to water the coat on the fur, because to get good connection. So we wetten it, hopefully with some warm water. The horse accepts that a little bit better than the cold water. Just moisten it and wetten it enough, and after that we're gonna add some conductive cream to get the optimal connection. So we use this SKanlab cream or SKanlab VET cream because it's made for this machine and this kind of treatment, and so we get the optimal electric field through the horse to be able to get the treatment going on the leg. So I add enough cream. Massage it down a little bit in the coat, and after doing that we're gonna go down to the leg and prepare the leg as well before we attach the electrode. Okay, then attaching the return electrode, we use a rubber band and put it around the body of the horse in the moist, and then we have this knot which makes it easy to tighten the band to get optimal connection. And I put the knot where I'm expecting to have the return electrode, because that gives some extra pressure on the return electrode if it's underneath the knot. Just have to find the band here behind. This is almost like pulling the saddle. He was a little bit thicker than I thought, so we just have to move this. And that's the easy why we have so many holes. We can move this around a lot and use it wherever it's needed. Then we should be good. And I tighten it firm, but not like he's stopped breathing. And I can tighten it even a little bit more. And I do that after putting the return electrode underneath. Then I have put the electrode underneath the rubber band, and I also put the cable just underneath the band. Then it won't be moving around. If the horse moves around, it won't pull the electrode away or something like that. So that's a kind of security for having it underneath there and keep it staying there. Just be sure that you get it proper underneath the knot. Now we're going to look into treatment of the sacroiliac joint on the back of the horse. Mostly it's a both sides problem, so we probably have to treat both sides with a full treatment, because it's a rather wide area we're going to treat, like I mark here on the hip of the horse. And wait, we're not finished yet. And why does the horses get sacroiliac joints problem? There are several different kind of reasons for that. One reason can be ridden in the wrong way, a blockage due to an action in the pasture, or too overload of activity, or too static activity and not enough moving and smoothing exercise. Why is it then beneficial using a SKanlab VET and SKanlab VM? The beneficial part of it is that you increase the temperature in the capsule of the joint, makes the joint able to move freer, and sometimes even the blockage will go away. You can be lucky, like just in 1 or 2 free sessions you can loosen up a blockage. Sometimes you maybe need 5 to 10 sessions to treat this, and over a period of 2 weeks. But mostly then you don't have to give them a shot in the joint, which some veterinarians do as well, but this can be a very beneficial thing to do. But still, you should always have confirmed it with the equitherapist or veterinarian before to get the correct diagnosis that you know it's an iliosacral joint problem. Before starting treating that area, okay, and then we have to wetten the coat with water to get all the air out of the coat and be able to get the cream down to the deep of the coat to get a good connection for the return electrode. Then we go on the Then we go on the pre-settings, and here we have a little bit higher energy level because we have a lot of soft tissue above, so there's no danger of getting too warm too easily, because we need more heat to get in the depth of the tissue and to get into the joint to reach it. Treatment time could be 10 minutes on each side here, because we need a longer treatment time for treating both those big joints. Then you pinch the on-off button and you are ready to go. And again, slow circles in a nice rhythm. And during the treatment, confirm if it's not too warm. Look at the horse response. Look at the ears sometimes. Look at the head, and just keep the horse in mind how they react. Normally shouldn't be any problem at all. They like it a lot. If it by any reason should be too warm, then you just decrease the energy by push on the minus. One step and go down. Normally with this iliosacral joint problems, I nearly ever go down on the intensity. I can stay on level 9 for the whole session. And of course, after treating the iliosacral joint area, again we use the sponge to get rid of the overload of cream that we still have on the tissue and on the fur. Wash it out as good as possible, and after doing that, rub with a paper or a towel to dry the skin and the fur as good as possible. And this is also of course nice if it's cold outside. Let the horse carry a blanket or something like to keep it warm after treatment. If you don't let them out in the rain without a blanket after this treatment, that will not be won't be so nice for the horse, and then we kind of disorder effect, because the horse will get tense again and he won't relax in the muscle. He will tense up very quickly because it gets cold and start freezing.